So moving on, let us look at the grades of shock. Now it is very easy to remember the grades of shock. So there are 4 grades: grade 1, grade 2, grade 3 and grade 4. If you've ever seen a tennis match, you'll have no problem in remembering the grades of shock. So grade 1, it's just like a tennis score. So grade 1, initially your score is 15 love. So grade 1 is 0 to 15%. Grade 2, what is the next score for tennis match? It is 30 love. So it is 15 to 30%. What is the next score for tennis match? It is 40 love. So it is 30 to 40%. And grade 4, game, set and match, it is more than 40%. Now, this 15% means what? It is a 15% volume lost of the total blood volume in a body. So now, in a human body, the total blood volume is approximately 5 to 6 liters. So 0 to 15 would be, it would be 750 ml, 750 to 900 ml. So 15 to 30% would be 900 ml to 30% of 5 liters, that is 1500 ml. Okay. So now what are the changes that happen in these grades of shock? Let us look at those. So a very important table which is drawn in Bailey and Love. So grade 1, grade 2, grade 3 and grade 4. Now grade 1, that is class 1 hemorrhagic shock, the amount of blood that is lost is the same amount that you can donate. It is the maximum amount that you can donate. So whenever you go to a blood donation camp, the maximum amount of blood that they can take in one sitting is 750 ml. But usually you will see that one packet of blood, whenever you've done your internship or if you're working in wards, it contains approximately 330 to 350 ml. So that is the amount of, if they want to be accurate while they take your blood, they can take around 350 ml. That is 1 unit of blood. But the maximum amount of blood that can be taken in one sitting is 750 ml because that is class 1 hemorrhagic shock and that does not harm the patient. So now what are the changes what happens in these grades, grade 1, 2, 3 and 4. So the pulse rate is normal in grade 1. The blood pressure is also normal in grade 1. The respiratory rate is also normal, that is there is no tachycardia. The urine output is also normal, that does not decrease. So now what actually happens? Some change will happen, right? A person is donating so much amount of blood. So if you look at the CNS system, central nervous system, the patient is slightly anxious. So this is not significant enough for it to cause a person not to donate or give him that much amount of blood. Now grade 2, what happens is, so the pulse rate, it slightly increases. So it is more than 100. The normal pulse rate is 60 to 100. So this becomes slightly more than 100. The blood pressure in grade 2 is normal. The respiratory rate is slightly increased. The urine output is slightly decreased. Now what is the normal urine output? The normal urine output is 0.5 to 1 ml per kg per hour. This roughly translates to around 30 ml. So up to 30 ml is the normal urine output. In grade 2, it is slightly decreased. So it is around 20 to 30. In grade 3, it is even more decreased. It is 5 to 15. And in grade 4, that is in class 4 hemorrhagic shock, you might get anuria. Okay. Now, what are the other changes in grade 3 and grade 4? In grade 3, the pulse rate, it is obviously increased. It is increased higher than what is there in class 2. So this might be more than 120. The blood pressure is decreased. So normally what happens in shock? In shock, there is tachycardia and there is hypotension. So what you need to remember is in grade 1, no changes happening to either pulse or blood pressure. In grade 2, there is tachycardia which is happening, and in grade 3, along with tachycardia, there is also hypotension. In grade 2, there is no change in blood pressure. This is where a question comes because this is where a student is most likely to get confused. Okay. Now, what is the respiratory rate? The respiratory rate, there is again tachycardia in grade 3. The patient starts gasping for breath. And what is the CNS state? In the CNS state, the patient is, he's confused. In grade 3, the patient is confused. In grade 1, patient was slightly anxious. Here the patient anxiety decreases. So it is mild anxiety. These are all subjective terms. In grade 3, there is confusion. In grade 4, there is full-blown confusion, and the patient is also lethargic. All right. So now, how do you treat such patients? So grade 1, if you give crystalloids, that is enough. Grade 2 also you will give crystalloids. Grade 3 and grade 4, here you have to give crystalloids and blood. Now, when I was an MBBS student, I used to always wonder, how do you measure this urine output? So I used to think that, okay, supposing, say, if a patient comes to casualty and the patient is in shock, will you make him urinate? So that was how stupid I was when I was in my second or third year MBBS. So how do you measure urine output? You measure the urine output by inserting a Foley's catheter. So whenever a patient comes to casualty, a patient who's in shock, any acute case, you have to first put an IV line and you have to first put a Foley's catheter.